There we go. Okay.
Okay. Thank you, April. Hi, everyone. Good morning or good afternoon, good evening, depending on where you are. Let's maybe wait just a couple of minutes so that people trickle in, and then we get started. For those who have just joined, we're just waiting another 1 minute, and then we'll get started. Okay, it's 3 past, so let's start. Thank you so much for everyone who was able to join today, our 6th meeting of the Community of Practice on Evidence-Informed Decision-Making and Citizen Engagement. We have the honor today of having with us Ruth Stewart, who has kindly volunteered to help us discussing the topic, and will present shortly on the intersections of these two different areas of work. Citizen engagement and evidence-informed policy, practicalities and process is the title of her presentation. So have here a few minutes for her to provide us an overview of the work she has been doing and how she has been approaching these intersections. And then we will have the floor for everyone to raise questions, to debate. This is, of course, going to be sparked by what Ruth brings to the table today, but also I think everyone can be free to bring up other topics that connect with the work they've been doing or questions that they've been grappling with when thinking through this interaction. And then we can use this time also to take advantage of Ruth's expertise on the topic to discuss our own issues and challenges. So Ruth, thank you so much for joining us today, and the floor is yours.
Thank you so much for the warm welcome. I am going to turn off my camera just while I'm presenting so that there's not multiple things to look at and screens that might not quite fit. Let me just get the technology to work so that I can share my slides. We did test this, but you know how it is. It doesn't always work quite as you expect. So hopefully you can now see my presentation.
Yeah,
Yes,
it looks good.
Great. Really lovely to have some new faces and some former colleagues on the call. And I'm looking forward to learning from all of you as well. So very much a conversation, I hope. I am joining you from Johannesburg today. It's a cold winter's day here in South Africa. And before I get started, I just want to recognize we're joining from all over the world, and even the term citizen can mean really different things for each of us, as well as what evidence means and what policy means. So I just wanted to recognize the diversity that we have here in the room. And also acknowledge that this isn't just an academic discussion. We're talking about real things, the real challenges that we have in the world at the moment, and how citizen engagement and evidence-informed policy might provide some solutions. We're talking about them in the context of war in Ukraine, of genocide in Palestine, of catastrophic floods in India, all sorts of very real challenges. So I hope that as I share some of the practical examples of the work that I've done, we can be thinking in the context of a world that needs solutions, and that part of those solutions are about citizen engagement and evidence-informed policy. So let me get started. And oh, I've ended up with an annotation box. I didn't mean that. Okay. So just to tell you a little bit about myself. So I grew up described as a third culture kid. I have a British passport and British parents, but I was born and brought up in Malawi. My parents were missionaries, but I am not a doctor and I am not a priest. But because of that experience of being from one culture, growing up in another, and then in fact living in many. So I was born and brought up in Malawi. I studied in the UK and I worked in Malaysia and now live in South Africa, where I've been for the last 15 years. So I've done this geographical boundary spanning. And I think that that's given me a sense of the importance of being a connector and a facilitator across different spaces. I was trained as an anthropologist, and I used to think that that wasn't really very relevant to what I did until I realized that it was very, very relevant, because so much about engagement and about evidence and about policymaking is about people. And I've spent the last, well, I'm getting a bit old now, nearly 30 years, really trying to think about how do we solve problems and how do we do that better through engagement with people in their lives and through engagement with evidence and policy. And I'm slowly learning to be better at telling stories. So I hope that in this presentation, I can give you some practical examples and stories of my experience in this space, and that can prompt discussion. And I'd love to hear stories from you too. So just to start us off, and this is often a slide or variations of this slide that I use when I present. I'm here because there are things in the world that are not okay. It's not okay that there's conflict. It's not okay that there is failures of public infrastructure and climate change and failed policies to tackle that climate change. And I feel quite strongly that we must share a motivation. Sorry, not to say we should share a motivation. We should have a clear motivation of why we're trying to do this work, and that it's not just an academic exercise. Now, I was trained at the epicenter, and I was chatting with April earlier before we started the call, describing how I did a similar role to the one that she has now around public involvement in systematic review specifically. But as I've gained more experience about the evidence world, I've also have to recognize that there are things that are not okay in that either. It's not okay that we produce academic papers that are a bit like paper airplanes. We kind of fire in the general direction of policymakers and expect them to read them. It's not okay that that's a picture of my PhD, that when I did my PhD and went to submit it at the university, it was used as a doorstop to prop open the door alongside the many other blue bricks in the room. The hierarchies of evidence that cause methodological debates, the inequities in how research is produced and the imbalance that that creates, and the barriers of academic publication. So when we think about citizen engagement and evidence and policy, we need to recognize that there are other things that are not okay about the world that we're working in, and we need to think about the role they play as well. So today I wanted to talk a little bit about citizen engagement in evidence-informed decision-making, but I also want to recognize that there's an importance of citizen engagement, there's an importance of evidence-informed decision-making, and then there's the importance of how they intersect. So I'll cover loosely, just briefly cover both of these areas. I know that I'm speaking to people who are already interested in evidence, and so will know many of these things already. So forgive me if I'm preaching to the choir, I think is the expression. But of course, we need to acknowledge that citizen engagement is important on its own as well. It's about making sure that there is greater effectiveness in the ways in which citizens live their lives and the decisions that are made about their lives. And it's about building greater trust and accountability, empowerment, avoiding conflict, and innovation and learning. And just to tell you a little bit about these two images here. So Picture at the top there is a place called Mthatha in the Eastern Cape in South Africa. It's where I supported a project as a 19-year-old when I was still an undergrad, and the first time that I came to South Africa. And I was here to work on a research project. And when I arrived, the whole project was scrapped within 24 hours. And it was because the academics had designed a beautiful study, but no one had spoken to the women who attended the clinics in the area around Mthatha or who ran those clinics, the nurses. So they had designed a project that included showing videos, and there was no electricity in those communities. So, or certainly no reliable electricity. So the whole project was removed within 24 hours. And even very simple level of citizen engagement would have helped us to know that that research design was not successful. The second example that I have here is from the Bakun Dam in Borneo, Sarawak, Borneo, which is where I lived for a while as an early career researcher. And what happened was that they took some decisions there to introduce a new hydroelectric dam. And what you're seeing here is the indigenous populations who are leaving their homes for the last time because they were being relocated as part of the creation of this dam. And because of insufficient citizen engagement in the planning for that dam, there have since been all sorts of conflicts and problems arising from this relocation because nobody consulted or engaged with these communities sufficiently. And that led to all sorts of disasters in terms of how that policy has played out. But of course, there's also value as and of itself of the use of evidence in decision making. And actually, it's the same list. It's valuable because it introduces greater effectiveness and trust and accountability, empowerment, conflict avoidance, innovation, and learning. So I wanted to share a couple of examples of my work in relation to the importance of evidence in decision making. So on a personal level, I've worked in and experienced in my own life how policy and practice around fertility, around maternal health, around newborn services are all problematic because there's so little evidence, particularly in private health systems like the one we experience here in South Africa. There's so little evidence underpinning many of the policies. And that leads to scenarios that are kind of exploitative and wasteful at best, and actually can do real harm to women and to their children. The other example is the war on drugs, which is this policy that many of you will have read about in the Philippines, where the president introduced an anti-drug campaign that was focused on essentially extrajudicial killings, arrests, and a militarized approach. So in order to tackle a problem of growing drug use within the Philippines, he introduced this policy with no credible evidence. In fact, directly contrary to the evidence that says that harm reduction and rehabilitation are much more effective than punitive approaches. And the latest numbers suggest that 12,000 young people died as a result of that policy that was made with no evidence. So we need to acknowledge that evidence-informed decision-making has a role in and of itself. And then, of course, citizen engagement in evidence-informed decision-making becomes a multiplier. And those of you who, we all experienced the pandemic, but those of you in the UK will know that the NHS, the National Health Service there, introduced a contact tracing app that was underpinned by some great evidence, but didn't have user engagement in the design. And that meant that actually some of the most vulnerable populations that the app was designed to support by tracking contacts weren't able to use it. And actually it was hugely, it suffered from really poor adoption and essentially failed the populations it most aim to serve. So we need to think both about the value of citizen engagement and evidence-informed decision-making and how together they can have such importance. So I promised I would share some more on the practicalities and processes, and I'm going to be drawing in doing this, both on my own experience of this work over the last 20 or so years, but also linking that to a paper that I wrote with colleagues when I was based at the Epicenter in London, led by Sandy Oliver, who I know has also presented to this community of practice. It's a paper that dates back to 2015, but it has a useful framework that I still refer back to in much of my work. So when we think about better evidence-informed decision-making through the facilitation of citizens in policy and practice processes specifically, I often draw on the work that I was involved in some time ago in the UK around introducing a new national policy for newborn blood spot screening. And so we went through a number of different processes to bring citizens into those policy and practice forums so that they could help to shape better policy for their own use. And this included a whole range of different approaches. So we used public consultations to gather citizen experiences across a wide range of the population. But we also engaged citizens in the policy forums. So my job was to help recruit and ensure that different parent groups involved in this particular test that's introduced for all newborn babies in the UK had a voice and were able to come to the policy forums. So when we think about how to facilitate citizens, we have to think through the whole process. Who are we going to choose and why? How are we going to introduce them to those policy forums? How do we brief them? How do we ensure that they have a voice, etc., etc.? If we think about better evidence-informed decision-making, it can also take place through citizen engagement in the policy, in the evidence itself, that then shapes the policy. So we can think about citizen engagement at these different levels. I've had the privilege recently of working on a youth employment insights hub, evidence and insights hub, I should say, funded by the MasterCard Foundation and led by the Pan-African Collective for Evidence, where CE-EIDM is based. And this has been an initiative for generating useful evidence. And so there's something very practical about thinking around what is citizen engagement in generating good evidence so that we can inform good policy. And this initiative has included some really important elements, including ensuring that there is youth leadership within the team delivering the evidence, and that there is a youth reference group of young people from across the continent, because this work has an Africa focus, so across the continent, and all the evidence that's produced as part of this project is peer-reviewed by that youth reference group, and they provide insights, and the reports and the shape of those reports, what they focus on, are revised to take into account the perspectives of those young people. So the other example I wanted to share was around how, and this, I believe this community is a really good example, around how evidence-informed decision-making is strengthened through citizen engagement in networks and communities of practice as well. And of course, that can have multiple elements. So having been part of the Africa Evidence Network for many years, I know that a lot of it is peer learning. So a lot of it is exactly what we're doing here today, engaging with one another and learning from one another about what citizen engagement is like, how do you actually implement evidence-informed decision-making and support others to do that, etc. But also around trying to think about how do we engage with citizen groups, whether it's advocacy groups, those delivering public services and receiving public services within those networks and communities of practice. So we can think also about those broader networks and the role they have to play as well in this process. So I mentioned that I wanted to draw on this paper that I'd referenced earlier on in slide 13. Sorry, this is slide 13. I'd referenced earlier on, I don't know why my note didn't appear. And really this paper, it shows its date just from the fact that you're looking at a graphic that I'm sure would be drawn more beautifully by AI now. But it brings together various different elements. And I wanted to work through some of them and just share some of the very practical experiences that have played out based on this framework. So just while it's in front of me, and I know that the text will be relatively small, but I hope that you can read it. Essentially at the top, it's saying, who involves citizens and why? And at the bottom, it says, well, who are those citizens? Who are you engaging? Is it the general public? Is it the specific populations, etc.? And why would they get involved? Because we need to consider both of those groups of people, the people doing the involving and the people who are being involved. And then there's a process of actually bringing people together. And what does that look like? And that can have all sorts of different formats. And we may choose very different formats depending on the purpose of this work. And then, of course, there's a process of involvement, including supporting input from citizens, and then how those inputs are engaged with and whether those ideas are expressed and engaged with. And then, of course, there's two additional pieces, which is around what's the purpose of the research, or in this case, the evidence-informed decision-making itself. And then in that bottom right corner, well, what are the impacts? And from our experiences as we drafted this paper as a team, we recognize that sometimes the impacts of citizen engagement are not the clear outputs that perhaps we might assume. For example, the policy may not change, but in the process of getting there, the people might change and their perspectives might change, and then the evidence itself might change. So there are a number of different pieces that we might actually be having an impact on in this. I want to just give you a few examples of how this framework is mapped out in my own work, and then I will wrap up for us to engage in some discussion. So when we think about who we involve, it's both who's doing the involving, so who is going to invite people. So if you think of citizen engagement and evidence-informed decision-making, there is a whole range of different ways in which or actors who may initiate that involvement. It could be the citizens themselves. It could be the people driving the policy-making process. It could be the people driving the evidence generation for the policy process. And sometimes referred to as intermediaries. It might be those organizations that are trying to bring these people together. And then, of course, there's a question when we think about the people of who are you involving and why would they want to get involved? And just to take you back to that newborn blood spot screening example, it was very interesting because this is a national policy so every newborn baby is tested. They take some blood spots from their heel, which is what you can see here. And in fact, this was one of the families and one of the midwives who we worked with who are in this picture. And they're very rare conditions that they test for. And many of the families whose children are found to have those conditions have motivation to get involved in these kinds of things because the conditions are so rare. So they actually saw my invitation to come and get involved in a policy process as an opportunity to learn more about their child's very rare condition. And so it took us a while, but understanding that that's what they knew they wanted and that's why they were there meant that we then changed how we engaged with those families because we recognized that they wanted something more and we needed to give them something in it as well as taking something to benefit our own process. And just to add that to the complexity of this, of course, the majority of families who have their babies tested in the screening process, children are very healthy. And those families don't remember it really. It's like, oh yeah, I remember you pricked my baby's heel and the baby cried, but they don't know what the conditions were. They haven't remembered because they've not had any ongoing contact with that service. So actually, sometimes it's harder and quite different to engage general citizens as opposed to citizens who've experienced something which might be rare and might result in very particular needs. So then if we think about the focus itself, now I think Bulelwa Mapela has been involved in this community of practice, and she introduced me to a very specific case around working on policy and practice relating to emerging funeral services in South Africa and trying to ensure that citizens involved in these processes and those generating evidence and those generating policy could come together in various ways. As you can imagine, the methods for engaging and discussing what was quite an unusual and in sometimes very sensitive issue around funeral services for very poor populations in South Africa is very different from citizen engagement in evidence-informed policy on climate mitigation in global forums in Geneva or national health policy in the UK. So we need to take into account what the focus is the work as a whole when we think about how we then go about the engagement. Now, when we think about the processes themselves, and I just wanted to spend a bit of time here thinking about this, there are different elements that are mapped out in that framework and summarized here around how you involve and how you engage citizens in these processes. And in my experience, they map out into three very particular areas. One of them is about how you do the initial engagement, the initial invitation. Because that frames the whole conversation. It frames how much power or not those citizens have to engage, and it frames the extent to which they have a voice. So a consultation, obviously, or not obviously, sorry, often is a written response to a survey that gets sent back to the powers that be and never seen or discussed again. Whereas some of the invitations that I was sending out in some of my work included getting to know people and really supporting them over a period of 2 to 3 years. And how I approached and invited those individuals was quite different. So in that case, we went through patient support groups or family support groups that were supporting the parents of these children with specific conditions. And so we engaged with them first. We had to recruit them first to the process. And only then would they help us to identify families who might be equipped and interested in getting involved in the process itself. So that initiation of citizen engagement, I think, is particularly important. The next level is how do you support the ongoing engagement? And as suggested earlier, of course, it depends on the process, and the focus of the evidence-informed decision making. But in my experience, we tend to skip that. So we're so pleased to get citizens who are keen and interested. And so we bring them along to a meeting, or we get them on a forum, or we ask them to write down their experiences. But we don't always think carefully around how do we actually support their engagement? Do we need to financially support their engagement? How do we spend time with them? So just to give you some specific examples, when I was working on a different evidence-informed policy forum, I would schedule a dedicated meeting with citizens beforehand, and I would go through the agenda. I would insist that the agenda was presented with everybody at the same footing. Now, of course, nobody arrives with the same footing. You have very powerful people in the room. There were, senior policy people because this was within healthcare, senior health professionals. And so I said to those who were organizing it, we need to remove all the titles. So we either going to use first names or we can use first and second names, but I don't want any professors. I don't want any directors. I don't want any, because the families that were coming along were, as I am, even today as a professor, immediately intimidated by those kinds of titles. And then I would go through that list of who was attending and tell a few little stories. Davi, he's really friendly. He might look scary, but he's really not. He's really dedicated to this cause. You're welcome to ask him questions later, really to kind of humanize all of those people who would be around the room. And then during the meeting, I would sit amongst the citizen contingent and ensure that they had a slot in the agenda, an opportunity to contribute, that any acronyms I asked, could you please explain that word? Because it's not always easy to ask for explanations for technical terms or for acronyms. And I would be engaged throughout that process with that group. And then there would be a follow-up afterwards. So it would usually be a phone call afterwards because people wanted to head home at the end of a meeting. But there would be follow-up afterwards. And sometimes that would include going through in writing, what we discussed this. Do you want to add any comments? I've just drafted these couple of points based on what you said. Are you happy with those? I'll feed those through to the group. So I do think that we often neglect how we support engagement in this process. And then the last piece is around what the decisions look like. And this can be really tricky because, of course, there's lots of different power dynamics within a discussion. Somebody might not share. Even if they do share, it might not be listened to. Even if it is listened to, it might be dismissed. And it could be, and this is why I was highlighting earlier on, it could be that it shapes some of the perspectives of the people involved, even if it doesn't shape the final decisions. So there's a task for us to do to think about what does it actually mean to have citizens engaged? What are the parameters that they are able to influence? And how do we then manage that process? Now I put this just to explain my birthday calendar example up on here, because this is what I often think about when people say to me, is citizen engagement, tell me about citizen engagement. Is it difficult? Does it take much effort? How much time and resource should I put to this? Because throughout that newborn blood spot screening work that I did over 4 or 5 years in the UK, I had a birthday calendar on the wall to mark the children's birthdays, to make sure that I regularly contacted the families and would wish them a happy birthday, wish their children a happy birthday on the right day. And I put that because I think sometimes we get a bit academic about all of this, and we forget that it's actually about people and relationships, and that the thing we must ensure we're maintaining throughout is a respectful relationships with whoever it is we're engaged with. And now, of course, with some groups, birthdays might not be appropriate, but for this particular group of parents with young children, it was just one of the ways that I was very proactive to ensure that we maintained those relationships. So then there is the last piece that I wanted to highlight, which is around how do we interpret and learn from what happens when citizens are engaged in evidence-informed decision-making. So how do they interact in the meeting? How are we tracking their interaction so that we can understand what their contributions are? What are those contributions themselves? And then what difference does it make? And I think the importance of having a learning framework around our citizen engagement in evidence-informed policy activities is really important, so that we can distill this learning at this different stage. Now, before I wrap up, I just want to tell you a little bit about what I'm working on now, because it's quite different, but it draws on lots of the same pieces. I am now the director of an initiative called the Alliance for Living Evidence, and I just want to show you what it is we're doing. I'm just going to click through these because they can be taken. So we're really looking to see how we can shift some of the power and emphasis and resource and energy away from that green box at the bottom, because so many of us who work in systematic reviews and evidence for decision making focus on the evidence banks, the generation of evidence to support decision making. I knew my children would come home at some point. They've gone away again. So we focus on that process of generating the best possible evidence in the hope that it'll shape decision making. What we're doing within Alive is starting at the top. So we're working on building partnerships of decision makers. Now, they may be policymakers, but they could also be citizen groups. And we facilitate those groups of those partnerships, those groups of decision makers around a specific issue, to engage and understand and align, to discuss the challenges they face, and to ask questions that they want answers to. And then we use those to drive the accumulation of data and analyses within those evidence banks, with their systematic reviews or maps, etc. And then we bring that evidence back to that collective of decision makers. And we're busy working on this as a cycle that we rotate through continuously to ensure that the decision makers are regularly being able to ask new questions and review the evidence and consider what this means. Now, what we haven't done yet is really engage with citizens in those groups at the top there. So just being asked to do this talk has really challenged me, because what we've been thinking about, there's a few more things here, is how can we ensure the evidence is useful, that the decision makers are at the center, that the evidence is dynamic, kept up to date, it's all about living evidence, and evolves to the challenges that decision makers face, that there's an efficiency of reusing and reusing this evidence and keeping it up to date, and that the evidence is timely, and last but not least, that it's plugged into those real world problems. So I'm taking away from this session the opportunity to now think again about this approach and how citizen engagement can play a role in the work that I'm doing now. Thank you very much.
Thank you, Ruth. That was brilliant. Yeah, thank you so much for sharing with us about both your trajectory, your experience, and in such an inspirational way. Yeah, it's really really powerful. I have many comments, but I would first like to open the floor to everyone else. If people have questions, comments, things that the words that Ruth shared made them think and reflect uh, against their own practices, right? Please jump in. If someone is not able to open their mic, please also feel free to type the questions or comments in the chat. We received a few reactions, Ruth, during your talk. Maybe you were not able to follow because you were speaking, but people very appreciative of what you were sharing and uh, agreeing with you on the importance of the aspects you're raising. Yeah, well, while people warm up, because sometimes it takes a bit, right, for people to be able to share. Maybe one thing that I would love to hear more from you, Ruth. I think one thing that really struck me as powerful from what you were sharing is that um, you, it's paramount for effective citizen engagement to do it in a humanized way, right? In a way that you're really connecting with people. And that actually made me think that this is, from what you were saying, I felt it goes beyond just like, oh, we need to do this because that's the strategic way of doing it, because that's like an important tool. But actually, like you're emphasizing that it's the other way around, right? Like the whole reason we're doing everything we're doing here is because we want people to receive better health policies or better policies or have a better life. So connecting with people in a genuine way, it goes first in comparison to everything else, right? And then because it goes first, it allows for effective citizen engagement and for the input to be relevant for the policies we're thinking through. And if we don't connect with people in this genuine way, then we are most likely missing out on key information and opportunities for building together. So yeah, I would love to hear more from you on this because that's what's uh, stuck with me from what you're saying.
Thank you, Davi. I saw that someone else had made a similar comment in the chat, so clearly a bit of a theme. I don't think I worked this out initially, I should say. I think I probably started as with many people, well, no, I shouldn't say that. I started by thinking this was a good thing to do because it would help my research to be better. And therefore, let me go and get some citizen perspectives. And I think it's really easy to think of it as a tick box exercise. And it's really easy to think of it as something that serves the work that you're doing. And I realized quite quickly that I was asking, particularly working with families whose children were really sick. I had to acknowledge that I was taking something from them and that I therefore had to have something that I could also offer back. And in my experience, really throughout my work, the best way of contributing together and everybody gaining something is to be really clear around what's the shared problem that you're focusing on. And citizens get involved because they agree that there is something that needs to change, something that needs to be improved on. I think it can be quite hard, and I learned a lot through Sandy Oliver and her work. It can be really difficult because, of course, they can be really challenging. And one of the issues with, I think, the way in which we do this work is we think we're right. We think we probably already know all the answers and that we're just going to check with citizens to make sure, I don't know, maybe a variable or two or a specific aspect of a policy that might change. But we tend to have a very narrow range of, territory that we're willing to move. And we're trying to get their engagement to be able to tick the box and to validate what we're doing rather than genuinely asking what's important to you, etc. So being able to have those conversations about what's important and to connect on a human level, I think is really important. I would just add one thing, which is that it can make it really hard. So people can come to you, and they did, with problems. They came, people would come and say, they treated me with so much respect, and I don't think I really deserved it, and I had to constantly be referring. So in the end, I ended up. So what happened was that some of these families, in this particular case, would come to me and say, "My child is sick, or I've been given this advice and I'm not sure what to do. Can you advise me on?" and I didn't know the answers. So what I ended up doing was also building a part of that kind of community and network of who could answer those questions and who could be supportive. And I think whether you're talking about relocation of indigenous populations because of a dam policy that hasn't been, or whether you're talking around, some of the health policy engagement work that many of us, I think, have done as part of our work, we need to be aware that that we will fail people. We can't answer and meet all their needs, but that we need to have some channels so that we can offer support as part of that process. I hope that helps kind of expand a little bit on what I was saying.
Yeah, no, that's great. Thank you so much for sharing. Shamira has shared a question in the chat. Maybe I can read it out. So let me read. Shamila, associate researcher, Escola Paulista de Medicina, so it's a Brazilian medical school. Hi, Ruth. Thanks for sharing how you leveled agency by introducing people on a first name basis and having professors and high-level decision makers introduce themselves on a more light-hearted note and joke a bit at first. I think that was also super insightful way of breaking this status barriers, right? It's exactly what we have been co-producing with 14 years old high school students, patients, and healthcare partners that we have been engaging in our citizen science initiative here in Brazil. It is what we had devised with the health technology assessment teams at the Ministry of Health in Brazil for the citizens, mostly patient representatives, at the meetings of commissions that decides which technologies will be incorporated into our public health system. But the Ministry of Health, health technology assessment teams seems to be having a little more difficulty in implementing it at that level. Question. We're starting to engage citizens in our qualitative evidence synthesis. Do you have any advice for us?
A great question. It's really difficult. So Shamila, you may have experience of this already. It would be interesting to hear from you, and I'm sure there's others on the call as well who may have insights into this. One of the things that I found particularly difficult in involvement in synthesis is that synthesis itself is quite complicated. So it's not just I'm doing some research about this. Would you like to come and help shape it? So I'm doing some research about this. And that idea of synthesis is quite a complex understanding, and it can be really easy to get into the nitty-gritty of the methodology. And we've just left, to be honest, most researchers are confused already, let alone because systematic reviews is so specialist and quite technical and methodological. So I think the only thing that comes to mind now is around thinking quite carefully about, do you brief people on those methods? Like, do you run a little intro session for them? This would be my preference if you can do it. Do you train the systematic reviewers not to use their technical language about PICOs and quality appraisal and critical and all those things, and to actually use lay language to say, well, what's our focus here? Can we get really detailed about our focus? Or can we think about what evidence is trustworthy in the context of this work or not, and try and avoid that technical language? So I think a lot of it is about how you prepare groups and how you can try and capture citizens' perspectives and take them into account without losing them with all that technical methodological language. I hope that that's helpful.
Yeah, as a follow-up to that, Ruth, I was also wondering during your presentation, like at first when you were sharing about your travels, right, in different places you've lived and your graduation as an anthropologist and how that has helped you understand the importance of navigating these different perspectives and worldviews. I think that in a way you were very lucky compared to most people that live their whole lives in one place, right? And they're only exposed to one worldview. So how can we help? And that's the case for many researchers, right? Many, especially maybe high-income researchers from high-income country researchers that the culture they absorb so much the culture of their own country. So how can we have this dialogue with the research teams so that we sensitize people to like be open-minded? It's like really shifting their worldview in a way you know, it's not obvious, right? It's more than just like explaining, oh, that's important, because it's
Yeah.
quite radical.
Really, really good comment. And I have to admit that when I meet people who are working in this space, they haven't always lived in different countries, but on the whole, and it'd be interesting to know how many people here today this might apply to, people have done at least one of living in one country and moving to another, or perhaps starting in one profession and changing professions, or marrying someone from a different culture, or even just learning a language. So I think there is something about our life experiences that makes us more empathetic and understanding of a different perspective. But it's also part of what we all experience in different ways. So it doesn't have to be being in a different country. It could be moving city or having a friend from a different culture. I think it's really about putting ourselves in someone else's shoes and thinking about what perspectives they might bring and what challenges they might face. And I'm definitely still learning how to do this. And I think a lot of it is about listening and learning from others and being aware of my own blind spots and the ability to do that. And as I'm speaking, I can see that the others are, Euphrasia, I was just reading your comment around thinking about you know, who you engaging with representatives, you're engaging with kind of those people with the actual experience. And so I think a lot of this is about how can we listen to other people's experiences and try and bring them to the table, whatever our own background is. So thanks for adding that in, Euphrasia.
I see that we have a hand up. Nithi would like to jump in.
Yes, thank you.
If
Firstly,
you'd introduce yourself first, please.
yeah, I'm Niti Rao. I'm a health systems researcher. I'm interested in issues at the intersection of health and environment. And I'm actually thinking through some of the recent work. So I'm based out of India. And in India, actually, no matter what the public health issue is, no matter how targeted the issue is, the population group, the affected number of citizens often tends to be diverse and just numerically huge, really. And this is a struggle. I'm just thinking through some of the last work about no matter how there's no one homogeneous citizen group. There's often many different kinds of groups. And one of the ways I feel we have, the choices that we make in terms of which types of groups that we engage with is actually can determine what kinds of findings we actually end up with. And there's a bit of a conundrum, about inviting people, and also to the point about building relationships. Often those relationships end up being with those groups that are already organized in some way, because of course you can't be exhaustive within a pragmatic project timeline and such. But at the same time, you end up then speaking with people who already have a voice in one way or the other. That's one. The second is this thing about when you invite people who with designations in some ways, that can sometimes mean that you end up with, say, media attention or social media attention. That means that it will get disseminated among a wider population. Whereas if you, spend the time, you might be really thoughtful and be able to gain real insights from small groups of people in, local communities who are really relevant. But it will often not have the impact in terms of the policy translation that you would like. And again, this is a conundrum in terms of how do you prioritize? And again, pragmatic issues from challenging low income, high population density context. And I was just wondering if any of Ruth and of course others had thoughts about this.
Those were great questions, Niti. I think we often talk about these things as though they're simple, and they're really not. I'd love to hear others' experiences as well. One of the things that we tried to do across a number of different initiatives was to make sure we always had at least 2 formats for engagement. So maybe some people more in depth, and obviously that could be like private engagement, if you like, a conversation with a well-trained researcher to engage and understand, or in depth as in those kind of participations in committees, and things like public consultations to make it more open. But you're absolutely right that we're always, unfortunately, tending towards the more powerful, the more empowered, engaged, eloquent people who might feel comfortable around a table at a policy forum or a research meeting, and we're not capturing everybody's perspectives and views, and we are making choices. And I think there's something about being transparent about those choices we make, that isn't the solution, but it does help so that people can see whose voices were included in shaping that process. The other thing that I learned was, so people kept saying to me, patient representatives, who are the patient representatives that you're engaging with in this work? And I began to realize that in English anyway, I'm sure it's different in different languages, but representative can mean two different things. It can mean I am the delegated representative from a community, maybe an elder or a leader of a community group. So I've been given the responsibility to be their representative. And I'm going to go and have a whole conversation with them about their views on this. So I'm going to take the issues back to my community, and I'm going to come as the representative and share them. But it also means I look like. So not necessarily gathering views from a wider group of people, but perhaps being a typical citizen, or which of course there isn't, but a typical parent in this experience, or a typical young person. And of course, those are quite different, and you make different choices depending on whether you want some of the average people in the room, whatever the average looks like, or you want someone who actually is a representative on behalf of their community and can move back and forth between these different spaces. It's definitely challenging, and I don't think I've ever got it exactly right. We've just always tried. But I'd love to hear from others here, because I'm sure there's other people as well who've tried the same challenge.
Yeah, thank you, Ruth. I think, I would encourage all participants to share if they have thoughts, experiences, right? Either in that topic or anything that is also related to what you've shared before.
Hi, Ruth. This is maybe just to a different point of your presentation, but I was just reflecting on the piece of, sending out surveys and then asking for feedback back. But of course, it'd be better to actually have a conversation with an individual, and just reflecting on how, I don't want to say challenging, but something to consider if you have a really large group. So with Cochrane, we have over 2,500. I think we're almost at 3,000 now, people who have kind of said, yep, I'm interested in getting involved in research. And of course, we have different methods depending on what we're looking for, but surveys can go out. I guess it's just making me reflect on, are there opportunities where we can ask individuals, would you be willing to talk more with us about your experiences? Yes or no, and then adding in your email if you're interested in chatting more. Would there be any other approach you would take to that other than that scenario with such a large group of individuals?
Really difficult.
Yeah.
I'm sure you have some of this, but it might be about making sure you've got like a profile, some kind of data on who those individuals are, like their profiles, and understanding who
Yeah.
they are, so that if there's a particular issue that maybe comes up
Yes.
in a synthesis conversation, you can go and find those people. You said you'd help. Well, I'm actually really looking for someone who had a really bad outcome in a hospital, because we don't really understand enough about that, what that feels like. Could you help? So I think it might be about having some more information about who those people are, so that because you can't
Yeah.
go to all of them, right?
Yeah, and that's something we're currently building out on our platform, basically for opportunities, having a profile just like this, like I have experience in X, Y, and Z. It gets, this is really like going on into complex challenges, but it gets challenging when it's a voluntary. Of course, you want it to be voluntary
Yes.
to tell about your experience. So there's maybe some people who, give a great deal of info, and then some people who aren't who don't want to share that information, as is totally understandable. But yeah, that's something where I think it's for us a lot about communicating, like that's open to you if you'd like to chat more about it, and here's the benefits of if you decide to put that in. And of course, Euphrasia is actually on we have an executive of 7 people. So those are usually the people that we would go to for a bit more actual conversation meeting every other month or every month or whatever it might be. I was just thinking tapping into that further group. No, that's good to chat about it.
Great.
Ruth, we have only a few more minutes left. Let me just open the floor again to see if someone wants to add a final question or comment.
I'm reading your comment, Shamila, around terminology.
We also have Veronica with her hand up.
Sure. Veronica, do you want to ask your question? And I'll come back to you, Shamila.
Yes, hello everyone. I'm just have a question, Ruth. I would love to know how will be the citizen engagement, or how you are imagining it would develop the citizen engagement in a live in the live work, because right now it's starting, no? So how you are like approaching it? Would like to hear more about it.
Ruth, before you jump in, sorry to interrupt. We only have 3 minutes left, right? So if you can stay a bit longer, I think that would be great for those who can stay. If not, that's fine as well. And for anyone that needs to leave, please feel free to leave as well. We're going to be wrapping up in a bit.
Thanks, Davi. I will give some quick responses. Veronica, thank you for asking that, because it's not something that we have fully engaged with yet, and we need to. We are we're trying to think of citizen engagement in the context of equity. So that's one thing that we've kind of made a conscious decision to say, this isn't just about how do we get citizens to serve what we're doing. It's actually thinking much more broadly around issues of equity. And then we've been trying to develop that equity plan and to think about different dimensions, including citizen engagement. So it's kind of work in progress and like a bit of a kind of watch this space. And I appreciate the question, because it's also a reminder to keep it at the top of my list and not let it drop too far down. And I just have one very quick story for you, Shamila, on terminology. So I once sat through a whole conversation with decision makers around HIV prevention across Southern Africa, and a UK facilitator, not myself, and they were all talking about CSOs. No, CSWs. And it took us a very long time before we realized that the African HIV professionals thought that the UK person thought it was a community social worker, and the African HIV professionals thought it was commercial sex worker. And so I sometimes tell that story when we get into this terminology debate about, what does you mean, etc., as an example of how wrong a conversation can go, where someone thinks we're talking about social workers and someone else thinks we're talking about sex workers, and the conversation can continue at length before we realize we're wrong. And I use it as you have suggested here. Sometimes jokes help. So I use it as a bit of a joke, but also a lesson. Let's really be careful about our terminology, because otherwise this could go very wrong. It's a great question. Thank you.
Well, Ruth, thank you so much for your time, for sharing your thoughts. It was such an insightful session. I really appreciate it and really enjoyed it. I'm sure the others did too. So yeah, thank you again for sharing with us and to engaging with us. And yeah, we'll have our next meeting within 2 months on the 1st of October. We'll share the details soon. Thanks again for everyone who joined, and to Ruth for her contributions.